Most pain doesn't come from injury. It comes from trigger points and muscles, but you have to understand which muscles are worth treating and which ones aren't. For example, I'm sure you know somebody with shoulder pain. It's an explosion these days. Your clients, your family, maybe even you. Most people treat pain by rubbing where it hurts, but that's actually just treating the symptom and not the cause. And it doesn't really work. More about that in a second. My name is Chuck Duff, inventor of the Coaching the Body method. I've had serious shoulder pain in my life, and nobody knew how to help me. I had to figure it out for myself, and now I've taught my approach to thousands of students at my school over the last 15 years. I'm going to show you some of this work in a moment, but if you want a more in-depth training, please register for my free 90-minute web class. You'll see links in the video below. Look forward to seeing you there. So this, we can get the lateral border, so we get teres minor, teres major, and I can get thumb compression on infra while we move into passive external rotation. I can even get supra compression there, and we can do contract, relax either way, or I can come in front of the scapula and catch some subscap. What's the tenderness there?
No.
And
Not
then
bad,
even serratus anterior fibers. And this has just created a whole lot more range here. So push down into my thumb toward your legs. Yeah, deep breath. Hold. Then exhale. Let it go. Relax. Arm hasn't done that in a while.
No.
And then you've got a little platform you can bring the yeah, because really a lot of what it's about is getting feedback on the right muscles. External rotation. So infra will also limit abduction because it's a stabilizer, so you'll limit that on, she gets pain there, and exhale. So here, as I put her into stretch, give her some feedback. This way I can give her feedback on the referral of the infra and bring her into more medial rotation here, and then get the liberator on the muscle. So push back into my arm with your elbow. So that's external rotation. That's firing the infra. Deep breath. And exhale, let it go. While you're stretching it, and use the arm to go into more medial rotation. So, let's see.
Yeah, it makes a really big difference when you push on that front shoulder when you do that stretch.
Exactly.
If you didn't do that, it would hurt too much.
Yeah, it would trigger your nervous system, shut it down.
Yeah.
See, now she's getting actual glenohumeral abduction, and then at some point the scapula does have to come along, and it's movable. I mean, that's almost normal. You're almost normal.
Thank God. I've been praying to find you for a year. I'm not kidding.
Follow the link below to register for my free webinar, How to Fix Your Client's Pain by Understanding Where It Really Comes From. You're going to learn an approach we call Trigger Point Therapy 2.0, which we use to consistently eliminate pain for good. I'll show you how to discover where pain originates, and it's hardly ever from an injury. You're going to start to understand why rubbing where it hurts never works. You're going to see our proprietary trigger point tool, the muscle liberator in action, and how you can use it to soften taut fibers in seconds if you know the right place to work. And to thank you for registering today, I'm going to send you a free copy of my Coaching the Body Out of Severe Shoulder Pain course, which is normally $39. Thanks for watching, and I look forward to seeing you in the webinar.